Good day. In this video, you will learn the correct procedures of the following: assisting elderly in changing clothes, assisting elderly on tub and shower bath, assisting patient who is able to brush teeth, offering and removing urinals, giving and removing bedpan, collecting urine and stool specimen, collecting stool specimen, and assisting the nurse with proper preparation and administration of oral meds.
Prepare necessary materials and supplies for the smooth carrying out of the procedure. Do the hand washing and wear gloves to prevent the spread of the microorganisms. Bring clean hospital gown to bedside. Raise the patient's shoulder from bed as much as needed to locate the ties or snaps at the back of patient's neck and unfasten the gown. Take gown sleeves off the arms but leave it across her chest for the time being. Drape the patient appropriately to prevent an exposure of her body. Place clean gown over and slightly lower than the used one. Then fold the used gown and place it in the laundry hamper. Adjust the clean gown at the shoulders and back, then fasten snaps or strings at the back and neck. Lie the patient again and ask if she is already comfortable, and then do the aftercare. Remove the used gloves and do the hand washing again. After that, record and report. Before proceeding, make sure to get the patient's vital signs to know if you can proceed or not intubating the patient. Make sure to inform the physician if there is abnormality into the patient's vital signs. Prepare all equipments for the smooth carrying process of the procedure. Then prepare the bathtub. Then place a rubber mat at the bottom of the tub. Then place bath mat, any disposable absorbent material in front of the chair or near the tub. Then place bath blanket at the back of the chair to cover the patient's after bath. Extra towel for drying hair of the patient. Then assemble equipment like washcloth, sponge, soap within reach. Make sure that the tub is clean to maintain cleanliness and safety for the clients. Assess the readiness of the patient and explain the procedure. Be sure that the patient is allowed to take tub bath. If in doubt, check the patient's chart in the nursery station. Assist client to sitting position on the side of the bed, then help the patient if needed to finish dressing in bathrobe and offer sleeper. Accompany or transfer the patient to the bathroom. Let the client sit on the chair near the tub. Bathing will be tiring. Transportation in a chair will conserve energy. Then explain or instruct precautions for safety. Fill the bathtub with warm water under 100 degrees Fahrenheit to 115 degrees Fahrenheit or 37.7 degrees Celsius to 40.6 degrees Celsius. Keep the client covered with bath blanket until tub is ready. Let the client check the water temperature to keep the client warm and prevent chills. Help client into the tub, providing necessary assistance to prevent falls that can occur and provide safety. And make sure to hang in occupied or in use sign to signal others that the bathroom is being used. Clients need privacy while bathing. Leave the patient alone during bath but do not leave the vicinity of the bathroom. Check on the client within 10 to 15 minutes. Be alert for any silent. Prolonged exposure to warm water may cause vasodilation and pooling of blood, which can result to lightheadedness or dizziness. If bath is completed, instruct the patient to pull the drain plug. Take bath blanket on the chair to cover her body. Provide necessary assistance in taking the client out of the tub and sitting on the chair. Remember, draining water and assisting the client getting out of the tub help prevent falls. Proceed assisting client with dressing and grooming, then help the client to room. Then do the hand washing, then record and report. prepared all the equipments and supplies for the smooth curing process of the procedure, the preparation for the shower stall, then test the faucet function. Before proceeding, make sure to get the patient's vital signs to know if you can proceed or not intubating the patient. Make sure to inform the physician if there is abnormalities into the patient's vital signs. Place the rubber mat on the shower floor and stool over the rubber mat. Place chair and bath mat outside the shower stall. To maintain cleanliness and safety for the client, place bath blanket covering of the patient after shower. Assess the readiness of the patient and explain the procedure. Assess patient to sitting position on the side of the bed. Assess in standing. Then accompany or transfer client to bathroom in wheelchair and offer sleepers. Showering or bathing will be tiring. Transportation in a wheelchair will conserve energy and accompany the client to avoid sleeping. Let the patient sit down on the chair outside the shower room. Explain and instruct precautions for safety. Turn on the shower and adjust the water temperature. Let the patient check. Testing temperature before entering prevents burn and scalding. Help the client into the shower room and sit on a chair providing necessary assistance. Remember, falls can occur. Provide safety for the client. Sitting on the chair will prevent fatigue. Hang occupied or in use sign. If the client is showering independently, check on the client within 10 to 15 minutes. Stay close to shower opening. To prolong exposure to warm water may cause vasodilation or pooling of blood, which can result to lightheadedness or dizziness. Turn off the shower and then offer bath blanket to cover herself. Help the client out of the shower. In assisting clients, help prevents falls. Ask the patient to sit on the chair outside the shower room. Assist the client in drying, dressing, and grooming. Then help the client to the room. Return to the shower room according to agency policy. Discard soiled linen, then place an occupied sign outside the door, and then return articles to proper places. To maintain cleanliness and good infection control practices. Then wash your hands and record and report. Prepare necessary equipment and supplies for the smooth carrying process of the procedure. Then do the hand washing. Raise head of the bed to place patient in a sitting position if this is allowed. This position will prevent aspiration. Protect patient's gown and bed with towel. Remember, do not soil patient's gown and beddings, for this will add discomfort to the patient. Assist patient as necessary. Offer help to rinse mouth. If help is not needed, leave him alone. Remove articles from cleaning when the patient is finished. Do the aftercare, then remove the gloves and do the hand washing again, then record and report. Assess readiness of the patient and explain the procedure. Raise bed rails and advise the patient to hold into it and that you will now start the procedure. Raise the head of the bed for the comfortability of the patient. Position the patient and start the procedure. First, grab the underpads and place it under the patient. Then, proceed to covered urinals and disposable towelettes must be placed at the side of the bed within patient's reach. Re-instruct patient regarding use. Always provide privacy by closing curtains and doors during excretion. Return to the bedside when the patient turns on signals. Take covered urinals to the bathroom. Measure or obtain specimen if needed. Discard in a toilet bowl. Rinse the urinal with cold water first, then wash and disinfect as instructed. Explain the procedure to the patient, then close the door and screen of the patient to provide privacy. Raise the bed to the high position, then put up the side rail on the opposite side of the bed where you plan to stand to provide safety to the patient and convenience for the caregiver. Take the bedpan, cover the toilet tissue out of the bedsheet storage unit. Put the patient on the bedpan. Leave and wait for the call bell of the patient, then emphasize privacy during elimination of removing bedpan. Remove and cover the bedpan, then carry the pan to the bathroom to collect specimen, measure the urine, and note for amount, color, consistency, and odor. Empty the content into the toilet and flush. Thoroughly clean bedpan with cold water, wash and rinse, then use paper towel for drying. Remove and dispose gloves. Give the patient a basin of warm water, then wash the cloth and towel or moist towelette so that hygiene can be carried out. Place the bed back into low position for safety, then dispose equipments. Do the hand washing again and record and report. Wear gloves in transferring the specimen from bedpan to urinal specimen bottle by filling 2/3 of the sterile container. Then close the cap tightly. Use the gloves to prevent or avoid contamination of the specimen. Measure the remaining urine for intake and output monitoring. Then discard remaining urine in the toilet bowl. Clean and dry the bedpan and put it in a designated place. Remove the gloves and wash your hands. Make sure to send the specimen to the laboratory with laboratory request form completely filled up with information that document the urine specimen has been collected. Explain and instruct the patient on how to obtain stool specimen. Prepare all the equipments needed for the smooth clearing process of the procedure, such as ball pen, commode, disposable gloves, and specimen bottle. Remember to wear gloves and use spatula to obtain stool specimen. Then close the specimen bottle tightly. Remove your gloves and wash your hands, then document the procedure. Assist medication nurse in the unit in transcribing confirmed doctor's order to individual patient cardex, preparation and transcribing of medication card as per institutional standard frequency, color coding per patient based on the cardex. Medication card content. Arrange medication card in a tray to avoid misplacement. Do the hand washing to prevent the spread of microorganisms. Properly check the label of the medicine and properly confirm the following date from the medication card: name of drug, name of patient in the drug label coincide with the medication card, proper dose of drug, expiration date, and frequency of drug to be administered. After properly preparing the medicine and reconfirming the contents of the medication card accordingly, proceed in assisting the medication nurse in the administration under her supervision as per institutional policy. Properly identify the patient based from the medication card and state your objectives. After care of the equipment used, putting the medicine card in its proper place, as well as the medicine glass. Leave the patient comfortable, then wash your hands and document the procedure done.